Hi guys, this is Dr. Bhupesh once again for you all, and today we are talking about listening. As I always say, like today I talked to one of the persons, and I'm really sorry that we were missing out on material on something. So, but sometimes when you do not have time, suppose today your class is at this 4:30 p.m. and you don't have time to do your reading and listening. So normally we have an excuse, sir, I did not attend the Zoom class because just because I did not attend the Zoom class, because I did not do reading and listening for today. Guys, if you have not done reading and listening for today, then you will learn even more. Because if you have come here to learn, that means you want to improve yourself. So if you have already done reading and listening, you think that way. But if you have not done reading and listening, then you will try to do it my way. Suppose if I am teaching you, you will learn it that way, that how am I doing. So if you have not done reading and listening, sometimes Zoom class still is very important if you are part of Dr. BKM OET Institutes. So please attend Zoom class as much as you can. Like in today, as we are doing this thing, so we are going to choose a random listening as has been ordered by you guys that you want to do random listening. So what I do, I will go over here and will say, okay, OET listening practice material. Let's see what comes our way. So, okay, you type and you can practice as much as you can. You don't have to worry about anything whatsoever. So before we proceed further, just wanted to make sure that am I audible to everyone? Just for once, am I audible to everyone?
Yes,
Yes,
sir.
sir.
All right.
Yes, sir.
I'm putting you back on mute. Sorry, guys. Thank you for responding. So suppose if I have to do any listening, I'm not choosing even the first one. I'm just going for a random thing. Okay, suppose if I go for maybe uh, this one. Let's see. There are some listings which can be hard.
Quite markedly. So how we
Let us choose some other one because I think that I have done it. So it will not be fair enough to do that. Suppose if it seems all right, let's see this one.
or two words,
Oh,
and
that's
generally
it. They have these they are basically from the authentic OET. So whenever you get time, you can listen to them. They have certain tips. But again, being a part of being Dr. BKM OET Institutes, I'm not that they would be able to help you at a certain point. But when it comes to learning very, very, very minute things, then obviously you need a complete video. So that's what I'm going to do for you. And that too random one obviously is a pleasure. So I'm just choosing this video right now. 25th question. I don't know what the question is like you. I don't know what this topic is all about. So I'm going to do in front of you. We'll try to record the session as well. And that is how you should practice. Suppose if you do not have time today, choose anything random, do 5 or 6 questions. If you do 4 out of 6 right, that means you are very good. So you don't have to worry. You don't have to do 22 questions to understand how good your listening is. You can just do like 6 questions. If 4 are good, you are good. So that is how simple. Okay, I'm gonna play this question. I don't know what this question is, so I'm gonna play in front of you. Okay.
Question 25.
Okay.
Now read the question.
Right. So the question I'm reading, by the time they give us time in the part B, you hear a doctor explaining gastroscopy to a patient. So it's a doctor-patient conversation. First, try to understand what is the scene. So scene is between doctor and the patient. What is the purpose of doctor's explanation? Now the question is different. That is what comes in reading as well. That is why I always tell you, reading and listening are same. You need to understand the question first. My question is not what is the explanation. My question is what is the purpose. The same questions come in the reading as well. What is the purpose? So these are difficult questions. You have to listen to the complete conversation. And in reading, we always say the last line is the most important line. So even in the listening, where the topic will end up, and the first line should be the most important line, that what is the purpose of doctor's explanation. Otherwise, if doctor is explaining gastroscopy to the patient, that means patient might have to undergo gastroscopy in future. If I am going to have a gastroscopy in future, then doctor will explain me. So what is the purpose? Obviously, but let's see how it goes. So I'm just going to play it. I have understood the question that it is about doctor-patient interaction, and I need to find the purpose. All right. Okay. So by the time you get this time, you read the options to make the patient sign the consent form before the procedure. So now you need to understand the topic. Consent form to reduce the patient fear of side effects. Side effects to explain the possible side effects before signing the consent form. So maybe patient is about to sign the consent form, but doctor is explaining the possible side effects. Now that is where you have to be good. Now B and C option are almost same, but there is a word possible. Obviously, this option has more chances, as I always say. Options having may, might, can, could, possible word has more chances of being an answer. Second thing, B and C option also differ because it says reduce the patient fear of side effects. And it says to explain side effects. So one is reducing the fear, one is explaining the side effects. So now by the time he's speaking, I should be able to figure out three keywords: reduce the fear of side effects, explain the side effects, or to make the patient sign the consent form. What is the main thing? Sign the consent form, reduce the fear, or to explain the side effects. Let's see. Now it will start playing. So in the exam, you will have all these things running in your mind by the time examiner would be speaking.
Now, I just have to go through some possible side effects of the gastroscopy, if that's okay with you.
Yes.
So now the first line she has spoken is she is talking about the possible side effects. So again, answer appears to be C from the first line, but in the purpose questions, we have to listen to the end to understand what exactly is the topic. That is why reading part B and C, listening part B and C are so very close. You need to listen to them, or in reading, you need to read them nicely, and you should not be in rush. You should have calm head. Okay.
First of all, I can assure you that in most cases, the procedure is problem-free. But I have to point out to you some side effects so that you are aware of them before you sign the consent form. Is that okay?
Now she's saying, I need to explain you the side effects before you sign the consent form. So again, it appears to be C until now.
Yes, fine.
Right. Well, some people can have a mild sore throat for a day or two after the procedure. And if you have been given something to make you drowsy, you may feel a bit tired afterwards as well. And some people can get a chest infection or pneumonia. But remember, this does not mean that you will necessarily get these as well.
Okay, I hope not.
And on the odd occasion, the endoscope can cause some bleeding or infection in the gut.
So until now, she's again talking about all the side effects. That's the only thing she's talking about.
And can also puncture the gullet or stomach, but this happens very rarely.
I see.
Is there anything that you would like to ask me or go over again, or are you okay with all this?
Okay. So I don't think so there can be any answer than C. To make the patient sign the consent form before the procedure, it can be answer as well, because she is, that can be answer as well. Otherwise, to make the patient sign the consent form before the procedure, that can also be. But she is explaining the side effects before signing. Now this is confusing. That is what we need to understand. And that is what makes this question tricky. Otherwise, in normal circumstances, I should do it C without even thinking, but it's just my first question of the day. And also I'm teaching you, I'm recording it as well. That makes me a little nervous as well, just like you would be in the exam. But again, you have to take the chance according to what is being said to you. So according to me, I'm confused between A and C, because ultimately the doctor wants to get the signature over the contract before the procedure. That is the main thing. That is the main purpose. But she is also explaining the side effects. But I think the main purpose should be signing the consent form. Now I'm very confused. Now please understand yourself. The more you think, the more confused you are. The more you think, that is what happens in reading and listening. That is what you need to understand as an examination taker. that it will confuse you. But what is the main purpose? I think it should be signing the contract. So I would go with A in this case. But normally, if I am sitting in the exam, if I am confused, I do not have time, I will do C. But I will listen to it again just to make sure maybe in the first time we have missed out on something. I will play one more time so that we can learn. Checking answer is very easy, but then we become judgmental. We do not learn anything. If we want to learn anything, we should try it again. Let's try it again one more time. Okay.
And some people can get a chest infection.
I have to go to the first
Some
step.
people can.
I have to go to
Now,
the-
I just have to go through some.
Okay.
Now, I just have to go through some possible side effects of the gastroscopy, if that's okay with you.
Yes, fine.
First of all, I can assure you that in most cases the procedure is problem-free, but I have to point out to you some side effects so that you are aware of them before you sign the consent form. Is that okay?
Yes, fine.
Right.
So now she's talking about procedure and ultimately she wants to get the signature over the consent. So I would like to go with A. It's a very tough choice for me. But if it comes in the reading, I should not waste my time because I am confused, not because of data. I am confused because the options are confusing. So the main purpose is explaining the side effects, or the main purpose is to get the sign the consent form before the procedure. But then she's talking about the procedure as well. She's talking about signature as well. That seems to me as the most probable. I will take your help. You can also participate. Otherwise, we will check the answer. If anybody wants to participate, we can. Or should I check the answer? Then we will participate.
Yes.
Sir,
I
A,
will go for C.
Okay. I don't know the answer. I have to check it.
I
I'm
will
sorry.
go for the A.
They say C to explain the possible side effects before signing the consent form. So again, if I would have chosen easy option without overthinking, I would have been right. Now coming back to this question again. This is nice. Now again. Now please try and understand that is what exactly happens in exam. The easy option would have been C. We all know. And that is where when we use overthinking, that is where we miss our marks. Because again, she was explaining. Why was doctor explaining? So doctor was explaining about the possible side effects before getting the sign. And this was easy, but we overthought. And that is what I always teach. Now go to my previous lectures. You will understand why this happened. Just because we were overthinking. So our easy question went wrong. And that is what I always tell you. When easy questions get wrong, then we fail. If easy questions go right, we don't fail. So that was a lesson for us to understand. Do not overthink. So that was the prime purpose of my explanation of this question, that do not overthink. So I overthought, my answer went wrong. We should learn, don't overthink, makes to explain. And the possible word was there. According to what I teach normally, I always say possible word is very important. May word is very important. I went against myself, against my experience, and I chose this one by overthinking. That can happen in the exam too. So when you have options, if it appears to be an easy answer, do it easily. Let's try one more question to understand more about OET listening. But this is a good lesson for both of us. Let's do the next one. Okay, let's go for the next question. Okay. 26.
The procedure is problem-free, but I
hope not.
And on the odd occasion, the gut, me or
Okay, let's do the second question and let's focus on this one. You hear doctor checking a patient's details with a colleague. So basically, you hear a doctor checking a patient's details with a colleague. So basically, there is a colleague of the patient maybe, or maybe the colleague of the doctor. Now, this is not clear. Patient's details with a colleague. Maybe doctor's colleague, so he must be a doctor. Maybe doctor talking to a doctor, or maybe doctor talking to a patient's colleague. But most probably doctor to doctor. What aspect is doctor focusing on? What is the main aspect where doctor is focusing? Let's see what is the main aspect. Okay. I will move it forward.
Mrs. T.
So by the
Hawthorne.
time you get time, you can understand the patient's detailed identity, the patient's drug administration. So what is main focus? Drug administration, detailed identity, or overall progress? Are they talking about patient's identity, or are they talking about drug administration, or are they talking about progress? Let's see.
Date of birth 4th February.
Sorry. Yeah.
Let's see now. Mrs. T. Hawthorne. Date of birth 4th February 1963. Hospital number 1834572Z.
So until now, she's getting into the details of the identity. It's very simple again. She's getting into the details of identity.
Was prescribed tramadol today, 15th October
So now she's talking about drugs.
2009, given intramuscularly 50 milligrams, started on 13th of October at 11:30. All okay. Maximum frequency every 4 hours, maximum dose 600 milligrams. Okay. To be administered as required intramuscularly and given by senior nurse Bond.
So now, what do you think is the answer? Now you need to participate. I am not going to take the risk again. Okay, guys.
B, sir.
B. I
Sir,
hope.
B. Sir, B, sir.
In the last question we have learned, we will not overthink. So let's go with B and let's check out the answer. Okay, 26B. See, we did not overthink. No problem, no pain, no problem. Now you need to understand one more concept. That is what I always am trying to teach you. Out of the 6 questions, 4 would be easy. So if we overthink, that means we do 4 wrong, which were easy. Suppose if I would have overthought in this question. Again, I would have done patient's identity. I would have gone wrong. But if I think easy, then I know out of the 6 questions, 4 would be easy. 4 in the part B, 4 in the part C first part, 4 in the part C second part. So I need to get 12 questions right out of 18. I will pass if I do not overthink. Also, out of the 6 difficult questions, I might get 1 or 2 right. So in that case, I would be able to score 400. But if I overthink, my 25th question goes wrong, easy one. 26th question goes wrong, easy one. Stupidity. That is why we need to do and go according to what they are saying. Don't overthink. Let's do one more question to understand more about it. Okay.
100.
Okay. Okay. So you hear, sorry, it's fast though. You hear a dentist talking to a patient about the implant surgery. So they're talking about the implant surgery, dental implants. What has the patient, again, this is the main question. Focus on this one. What has the patient misunderstood about the proposed treatment? And also I want to mention again, if by chance 25th question goes wrong, otherwise it was easy, maybe we overthought, maybe A could have been the answer. That's why I chose the answer as well. But that question was tricky because purpose question, you don't know what is the main purpose. But again, she was trying to get the consent form signed as well before the procedure. That was also important thing. So that was also the purpose. A could have been the answer. But then you don't regret about questions like 25th. You do not overthink. At the same time, you don't regret if this question goes wrong because that was tricky. 26th question should not go wrong, the previous one. And let's see 27th. What kind of question is it? So 25th, I will say, was moderately high, tricky question because, again, according to me, purpose was also to get the sign and purpose was also to explain the side effects. Both were, I can't help it. So it's my fortune, it's my luck that will work. But in 26th question, it's not my luck, it's just simple process of the mind. Let's see how is the 27th question. What has the, now this is the main question. What has the patient misunderstood? Now present perfect tense means patient has already misunderstood about the proposed treatment. So let's see what is the problem of the patient. What has he misunderstood? Let's see. Okay.
So that's all done. Was there anything you wanted to ask me?
Yeah, I've still got this big gap on the other side. I remember.
So now by the time he has just spoken one line, I have read 3 important points. That is what you need to understand. Noun. Go for the noun. Noun means, first of all, pick up the important words. Which tooth? Means he doesn't know the tooth. Which cost? How much it cost? Is he talking about money? Is he talking about surgery? Or is he talking about tooth? That's the only thing we need to find. When the nouns are different, tooth is different from surgery, and cost is different from both of these. That means we will not have to go into adjectives. Noun means I just need to understand whether they are talking about cost, whether they are talking about extent of surgery, or whether they are talking about tooth. So what has the patient misunderstood? I just have to go through one word: tooth, cost, or extent of surgery. Let's see what has he misunderstood. Okay. Should
That we might do an implant there too, but
Done. Was there anything you wanted to ask me?
yeah, I've still got this big gap on the other side. I remember you said we might do an implant there too, but that it'd mean a slightly different procedure. If I remember correctly, you said that you couldn't put one there because of the bone,
Mhm.
but that you could connect it to the tooth next door. Is that right?
Well, partly. What we discussed was what we'd do if you lost the next tooth along. So
basically she's saying that he was saying that there is a tooth on the other side too. It's exactly the tooth like this, and you were saying something that you will be linking another tooth. Then doctor said partly that you maybe have misunderstood. That maybe you have misunderstood. That means, and she's about to tell, dentist is about to tell that I was saying if you will lose another tooth, then we will do this thing. So maybe most probably they are going to talk about the extent of surgery required, most probably, because she's saying that I was talking if you would have missed one more tooth. Let's listen to it again.
what we discussed was what we'd do if you lost the next tooth along. So we'd have to extract that one.
Right.
Then you'd probably need a bone graft there so that we could attach two teeth to a new implant. The gap you're talking about is where you've lost a big molar.
Right.
We couldn't fill that gap completely using this technique because that'd put too much pressure on the implant.
I see. Well, you said the price would be much higher than the one I've just had done. I guess that's why.
Uh-huh.
So basically, they are not worried about the price, both the dentist, and they think that they have to pay the price higher. Obviously, the surgery would be more. So most probably they are talking about the surgery itself, as far as I think. Again, if I overthink, I want to go to A, or maybe I have heard it wrong. So need your help again, guys. Please participate.
B, sir.
B,
Sir,
I
B.
B, because they're talking
B,
about
sir.
drafting, they're talking about the extent of the surgery. They're talking so many things. So I also believe B, and not to overthink, I will go with B, but let's listen to it one more time just to learn. And again, when you practice alone, that is what patience you need to have. Now we know it should be B. Let's give it one more chance and try to learn more from it. Let's give it one more chance. Let's see.
Or, but that it'd mean a slightly different
Wanted to ask me?
Yeah, I've still got this big gap on the other side. I remember you said we might do an implant there too, but that it'd mean a slightly different procedure. If I remember correctly, you said that you couldn't put one there because of the bone,
Mhm.
but that you could connect it to the tooth next door. Is that right?
Well, partly. What we discussed was what we'd do if you lost the next tooth along. So we'd have to extract that one.
Right.
Then you'd probably need a bone graft there so that we could attach two teeth to a new implant. The gap you're talking about is where you've lost a big molar.
Right.
We couldn't fill that gap completely using this technique because that'd put too much pressure on the implant.
I see. Well, you said the price would be much higher than the one I've just had done. I guess that's why.
Uh-huh.
Now, again, I don't know, maybe I am overthinking, but again, this is something. She is also talking about that the tooth you are talking about is molar. And we cannot follow this technique on that tooth. So I'm talking about the tooth next to it. And maybe I'm overthinking, but we're just discussing, and I'm also recording this session. It's little tricky for me, but again, I want to be as authentic and genuine I can. But try to understand that dentist was saying that we can't do it on this tooth because it is molar. So we are talking about the tooth next to it. So maybe they are talking about which tooth would be replaced. And obviously they are talking about extent of surgery, but I don't think so. They are talking about how much surgery is required. Again, I'm overthinking. I don't know. Let's give it one more shot if you don't mind, guys. Should we give it one more shot? Maybe we will learn something from it.
Yes, sir.
One more time. Let's see. If it's
I
overthinking,
see.
if it's overthinking, then we will understand definitely like 25th question we overthought, and we should not do that. That is what exactly is the criteria I want to teach. But maybe today I'm sitting in office. It's first time I'm sitting over here and taking class. So that can be also the thing for the overthought. So I don't know, but let's see how it goes. Yeah. Okay, let's listen to it again.
Oh,
Lost a big molar.
right.
Lost the next tooth along. So it,
Could connect it to the tooth next door. Is that right?
well, partly. What we discussed was what we'd do if you lost the next tooth along. So we'd have to extract that one.
Right.
Then you'd probably need a bone graft there so that we could attach two teeth to a new implant. The gap you're talking about is where you've lost a big molar.
Right.
We couldn't fill that gap completely using this technique because that'd put too much pressure on the implant.
I see. Well, you said the price would be much higher.
I really want to go with B, but I don't know. Again, I'm confused, maybe out of the overthought. Should I check the answer now? Which answer do you want to go with? Everybody is with B.
Sir, I
Yes,
will go
sir.
with A.
Little
Um,
confused. Let's check it out. Let's check it out. I am not quite sure. Don't go with me. 27B, again, they are going with the simple thinking to not overthink the extent of the surgery required. So maybe they were talking about that, the extent, because they were talking about tooth alone. So again, we overthought and again we went wrong. Again, we should not overthink. I should also teach myself and you should also learn. So today's lecture is all about a different strategy I wanted to adopt today for you all. Don't overthink. I always teach you don't overthink. Today I am overthinking just like you and participating with you. I hope you all learn from my mistakes. Sometimes you do not learn from your mistakes, but you learn from the mistakes of the mentors. So again, overthinking went wrong. Suppose if I would not have overthought, what would have happened? Maybe at least one question would have gone right, 25th or 27th. At least one. But when I overthought, both the question went wrong. So which technique is better? Overthinking or less thinking?
Less thinking.
Less thinking.
Less thinking.
Because again, when it comes to the final exam, at least 60% exam would be easy. So would you like to lose your 60% just because of 40%? Or would you like to secure 60% first and then maybe try your luck on the difficult questions that at least you can 10 or 20% from 40%? What would you like to do? Would you like to lose 60% or would you like to gain 60%?
Try to
Gain
gain
60%.
That is exactly the point. That is exactly the point I have been teaching you for such a long time. Don't overthink. In listening and reading, get your easy questions right. Then jump onto the difficult questions. And then try your luck. If you can secure your 60% by easy method, and you get 40% wrong, even then you have chances to pass. Out of 40% difficult questions, if you can get one or two right, you will secure 65 to 70% marks, which are the passing marks in OET. So please try and understand. If we would not have overthought, things would have been much easier. Exam would have been much easier. Things would have. Don't overthink or don't underthink as well. But yeah, they were talking about surgery, but then we thought over. I made you think over, or maybe they are talking about the replacement of the tooth. That is where we go wrong. Even if by chance, again I'm telling you, 25th or 27th, if we would have done both easy, even if one would have been wrong, we could have afforded 2 out of 3. But 1 out of 3, and that too making my exam difficult, is stupidity. Absolutely ridiculous. I should not do that. So today I promise myself, and today you should promise yourself, we will not overthink unless we are 100% sure that something else is the answer. If we are confused, we will go with an easy option. Okay, so let's repeat. When we will be confused, what will we do? We will go with
Easy option. Easy option.
Easy answer.
I agree with you all. Let's focus on one more question and let's
Gap you're talking about is where you've lost.
let's think easy this time. Okay, are you ready, guys? Should we jump on to the next question, the fourth one?
Yes, sir.
Yes, sir.
Yes, sir.
Don't be embarrassed. I should also be embarrassed. We are learning now. That's fine. Today we are in the learning mode. We should learn. Don't overthink. Okay. And that is why you should not judge yourself as well. So please don't judge me. Forgive me. Maybe today I'm in different mood of giving you a long-term lesson. You don't know what is the strategy, but anyhow, we should learn not to overthink when we are confused. We should think that the question is easy and should not overtry. Okay, coming on to one more question, which is 28. Let's do it. To hear a sports nutri talk on the challenges in the routine work, what must they be wary of? Wary of means what they should be concerned of. Wary is a negative word and it comes out of word like war, W-A-R. But again, I normally know it's a negative word. So the question is, what you hear a sport nutritionist talking on challenges in the routine work, what must they be wary of? Who should be wary of? Sports nutritionists should be wary of. Okay, let's see what is the topic. Okay.
Challenges. I suppose there's positive and we have to look for the positives of that.
Now generally asking. We are doing fourth question. Do you think it's an easy question as compared to the previous one or a difficult one? Tell me. Easy or difficult? What do you think? What do you think, guys? Easy or difficult, this one?
Difficult, sir.
Yeah.
Difficult.
We did not understand the question well. Then we did not understand the vocabulary. Then we did not understand flouted. Then there is a big thing. Now it is the time where you can take your risk. And in these kind of questions, I go by my techniques. If they will be talking about BMI, struggles faced by athletes for the optimum BMI, contradictory messages being circulated, adopting to opinion flouted by the sports person. So sports nutritionist means the person who provides nutrition to sports people, specialist of nutrition to the sports people. He's talking about the challenges in the routine work. Now he's telling the sports person what to take care of. Adopting to opinion flouted by the sports person, I don't think so it should be answered. But flouted is a vocabulary word. And then again, it comes according to my experience. Like the possibility word, I told you that can be answered. Whenever there is a massive vocabulary change happening in any option, then it has more chances of being an answer. Means if I have to do answer out of these, and if I do not get option to listen, of course we will listen. But if suppose somebody says, what would you like to do out of ABC? I will go with A, because flouted word is given, which is a vocabulary word, generally, as per the rules. But let's do it. Let's listen to it and let's see where we go. Let's try.
For me, a big challenge really in terms of nutrition is
challenges.
I suppose there's positive and we have to look for the positives of that. For me, a big challenge really in terms of nutrition is that everybody eats and drinks, so everybody has an opinion on what they are eating and drinking, and athletes are no different than the general population. You can hear messages or stories or information coming across, and sometimes that information might be suitable for Joe public on the streets, but in terms of an athlete that's training twice or three times a day, that can often be a difficulty. And factor in a couple of other things like changes in body composition, trying to gain weight or trying to lose weight. Athletes sometimes struggle with those.
Okay, so the major thing is the problem in the listening itself. Chances are less it can happen in the exam. So this question already was difficult in vocabulary. Now it is also difficult in listening. I hope you are also listening less, as I am listening it very, very, kind of clumsy. But let's see. And again, I will try to listen to it and we will try to pick some words. Okay. I will make pauses wherever I can pick up the word and I will make my laptop closer to myself so that I can put my ears on. Okay. Let's try one more time. Okay.
Challenges. I suppose there's positive and we have to look for the positives of that. For me, a big challenge really in terms of nutrition is that everybody eats and drinks, so everybody has an opinion on what they are eating and drinking. And
So she's saying that being the nutritionist, my biggest challenge is that everybody gives suggestions, everybody gives advices that what they are drinking, what they are not. That means everybody has opinions. So that means she's first concerned about that everybody provides opinion. Okay.
athletes are no different than the general population. You can hear messages or stories or information coming across, and sometimes that information might be suitable for Joe public on the streets, but in terms of an athlete that's training twice or three times a day, that can often be a difficulty. And factor in a couple of other things like changes in body composition, trying to gain weight or trying to lose weight. Athletes sometimes struggle with those particular aspects of things, and quite often sometimes want to go for the quick fix. And sometimes my messages are quite often the longer fix type messages, and that can be a challenge. So I suppose for me as a practitioner, the challenge for me every day is to make that message real. It's to make it suitable to the person that I have in front of me, but also it has to be relevant in terms of the science behind it. So sometimes the science doesn't really change, so I have to change the message or the way I adapt the message for the individual.
All right. So overall, what I think, she was talking about that. So she was talking about that normally I could listen to one of the lines where she was saying that sometimes it is applicable to the general public, but it is not applicable to the sports person. That is what I mostly have to take care. So that's the only line. Adopting to opinion flouted by the sports person, by means should be a passive voice. That means by the sports person. Adopting to opinion flouted by the sports person. So I don't think so this should be answered. It can be answered as per my normal rules. Again, if this answer goes wrong, then again we have to stick to normal rules because vocabulary change is happening. But again, the first thing is that she was saying that sports person do not give the messages, is the general public, general information that goes, and then sports person listen to it. That is what goes wrong. Then contradictory messages being circulated around. Contradictory word is the word that is actually should be the answer, because they were talking about sometimes this kind of message does not fit in. But again, hearing was also poor because the voice was not loud. The voice was really tricky. On the top of it, question was big. So this is a difficult question. And now again, on this question, you should not worry about. Now you can do anything. If you feel like A, you do A. If you feel like doing B, you can do. But as far as I think, she was not talking about BMI. As far as I think, she was talking about that sometimes messages for the general public, but sports person pick it up. But I did not listen to it. I cannot help it. So in the final exam, what do I need to do? I do not think about questions like this. Never. So 25th, I learned I should not overthink. 26th, I did right. 27th, I should not overthink. In this, I will not again overthink. I will go by word B. If the answer is A, even then I cannot do anything. But I am picking up B rather than A, just because she was saying that message is applicable for the general public, but sometimes sports people take it. And as far as I know, passive voices, it appears like adopting the opinion flouted by the sports person. Flouted by the sports person, maybe spoken by the sports person, and people adopt. So the message was about message should not go from general public to sports person. And option A is saying that message is going from sports person by the sports person. So I think message is going to the sports person is wrong. But in this A option, they are saying message is going by the sports person. But also I'm worried about this word flouted. As per my normal rules, answer should be A. But if I do not overthink, answer should be B as well. So this question, I would never blame myself. And I don't care whether I do A or B, but still we'll check out the answer. And let's see whether I'm going. So yeah, 28B is fine. So this time my speculation went right. So if it's my final exam, I have done 2 easy questions wrong, but I have done 2 difficult, I have done 1 easy question right and 1 difficult question right. But in this, if I can teach you about the last thing we are doing for today, we will not overdo it. 1 more question we will do. That's it for the lecture today. But you will learn a lot if you will listen to this lecture again. It will go to your subconscious. Do not overthink, do not overthink, which is very important message for our final exam. Second important thing was if you can learn active and passive. She was saying that being a sports nutritionist, sometimes the message is applicable for the general public and it goes to the sports person, which is wrong. Whereas option A is saying that flouted by the sports person. That means message is given by the sports person to the general public. So it's just active and passive that helped me to do this question. And then they were saying that I was worried about the message that goes wrong. So obviously she was talking about the messages. So I did B. I did not overthink. My difficult question went right as well. So again, please listen to this lecture, the words I am speaking, because once you listen, obviously you do not understand, but when you listen to it again and again, you learn more from it. Just the last question of the day. Let's try one more. Okay.
Become straight, but be a difficulty and want to go for the quick fix in terms of the.
Okay, one more question. Now this question seems easy. There are not too many words, and I can see you had a surgeon describing a debriefing meeting.
Okay, we need
conducting a debriefing meeting with his team. What problem are they going to follow up immediately? Now, Mike, what is the main keyword, guys? What is the main keyword? What is the main keyword that I should be taking care of?
Immediately.
Immediately.
Now let's focus on this word. So yeah, thank you very much for responding. So what problems are they going to follow up immediately? All right, immediately word should be there. Let's see. Now by the time I have read 3 nouns, 3 important words.
do our debriefing.
Procedures, equipment, or paperwork. 3 important words. Procedure is different from equipment. Equipment is different from paperwork. So I just need to find what is the thing that is going with immediately. Paperwork, equipment, or procedures. That's it. Let's settle.
Any comments about the case, Jackie?
Well, we were late getting started due to a delay in getting the surgical consent to come in, but I've talked to the junior resident and I think we just had a few crossed wires there, so it's sorted.
Yeah, we were busy in clinic this morning.
Until now, she's talking about equipment, I guess, right? I will listen to it again, sorry. We'll make it sure.
Well, we were late getting started due to a delay in getting the surgical consent to come in, but I've talked to the junior resident and I think we just had a few crossed wires there, so it's sorted.
Yeah, we were busy in clinic this morning, but we were also delayed getting into this room because the case before us went over their time, which pushed us back. That's becoming a regular occurrence with that particular team. I'm going to ask our nurse manager to adjust their time slots based on the recent history of their cases.
We were also slow to get the portable films from radiology. There were several rooms requesting films and radiology seemed short-staffed. That's unusual for them, but let's keep an eye on that. And if it happens again, raise it as a concern.
So again, maybe what they are going to follow up immediately. All right, I will take your help again. What are they majorly talking? So again, see, we will get only 1 chance in the final exam. But again, don't overthink. I have unmuted you. What do you think they're majorly talking about? What are they majorly talking about? I have unmuted you guys.
There were
The
several
procedures are
rooms
not
requesting
running
films.
by the schedule.
Sorry.
Sir, I think the procedures are not running according to the schedules.
So they made, because the main thing is that the procedure is not running on the schedule. There are two reasons for that. One is paperwork, second is equipment. So I
Yes, sir.
it should be answered because procedure is not running on schedule because of two major reasons. One is paperwork, we are getting that sorted, and equipment not readily available. That was the second thing. So all the options are correct. Let's listen to it once again. We will not overthink. We will do it A, but let's listen to it again just to learn again what to do in the exam, not to overthink. So again, answer should be A. We are not overthinking, but let's see if we can listen to the word immediately, maybe in this round. Because I have not listened to word immediately anywhere.
Fine.
Doesn't really change, so I have suitable to the question.
Okay, sorry.
Comments about the case, Jackie?
Well, we were late getting started due to a delay in getting the surgical consent to come in, but I've talked to the junior resident and I think we just had a few crossed wires there, so it's sorted.
Yeah, we were busy and
So the problem has already sorted. So what problem are they going to follow up immediately? Now this problem is sorted. So this is not a problem anymore, paperwork. That is also we should listen. So I think this problem is sorted. So they are not going to deal with this problem. Let's see other thing.
this morning, but we were also delayed getting into this room because the case before us went over their time, which pushed us back. That's becoming a regular occurrence with that particular team. I'm going to ask our nurse manager to adjust their time slots based on the recent history of their cases.
We were also slow to get the portable films from radiology. There were several rooms requesting films, and radiology seemed short-staffed. That's unusual for them, but let's keep an eye on that. And if it happens again, raise it as a concern.
Okay. So I think they are majorly concerned about procedures not running on schedule. Paperwork is already sorted. C should not be my answer as far as I think. If C is the answer, I can't help it. Then I have to doubt this listening. But they are saying C problem is already sorted. So they are not going to follow up this problem because it's already sorted. Second thing they are concerned about, that procedure is not running on the time. So they are going to tell the nursing manager to look up the history of the patient. So when we're looking up the history of the patient, that so that they can help, so that procedure can be time scheduled. Then the last important thing was equipment not readily available, but there was special word. She said also. Also means that apart from this thing, there was one more problem. That was of the equipment. But then there was one more word that was confusing. But again, now I have done so much of wrong. I don't want to overthink. I should go with A. But again, don't know what will happen. But again, not overthinking is A. But if by chance this question is difficult, then let's learn the mark scheme again. 25th will go right if I think easy. 26th will go right if I think easy. 27th will go right if I think easy. 28th will go right if it's easy. 29th will also go right if it's easy. If by chance, again I told you 4 will be easy to do. If by chance this question goes wrong, that's okay, 4 out of 5. But if I overthink, then 25th also goes wrong. 27th also goes wrong. This will also go wrong. I'm not sure if this is difficult. Even then, I am in benefit if I do not overthink. So let's see the answer 29. Seems like A. So if I do not overthink, all the answers go right. That is what is the basic. That is what I'm telling you every day. That is what I took the lecture on yesterday at Mohali Institute. So the final message to you all by this listening is please take it easy. You will 60% of the paper in your control if you do not overthink. This is Dr. Bhupesh from Dr. BKM OIT Institutes. If you have listened to video until now at this until this point, that means you really wish to pass. Please listen to it one more time. You will see certain things which I have tried to fill in your subconscious mind. Thank you very much.